Hello and welcome to the ALCSI podcast, where we share stories of lung cancer patients and their caregivers, as well as the work of doctors and researchers in the field. Today, we have the great honor and privilege of having Hannah Safron with us. After completing her undergraduate degree in public health in Chicago in 2021, Hannah set off on a year-long federal service volunteer program with the AmeriCorps. She has experience in urban agriculture, disaster relief work, affordable housing construction, and trail maintenance. For the past 2 years, she's worked full-time at the GW Cancer Center as a community health associate in the Office of Community Outreach and Engagement. Her work focuses on community health education and patient navigation for priority populations, including African American, African immigrant, Latino, and queer communities in GW's area. She's currently pursuing a master's in public health with a concentration in community-oriented primary care. Hannah, we are so honored to have you on our podcast today. Thank you for your time.
Thank
To,
you so much for having me.
yeah, of course. And just to introduce the moderators for today, my name is Jacob Rashap.
And my name is Pranav Mandyam, and we are with the American Lung Cancer Screening Initiative, a national 501(c)(3) nonprofit working to raise awareness for lung cancer and lung cancer screening.
Just wanted to start by asking, how did you first get involved with community outreach in general? Like, what drew you to it? And then how did you get involved specifically with lung cancer outreach here at GW?
Yeah, so with my experience in the AmeriCorps NCCC program, that kind of got me involved in outreach for the first time. In that program, it was a federal service volunteer, sort of 10-month experience. And my role, in addition to partnering with community organizations, was actually conducting outreach to help recruit for the program. So I would be tabling at high schools, trying to get the word out about AmeriCorps NCCC. And I was able to bring those skills into my work with GW Cancer Center to strategically meet our priority populations, whether that's at grocery stores, churches, food distributions. And I began really honing in these sort of skills with lung cancer outreach in particular during Lung Cancer Awareness Month back in 2023, where I actually met a couple of providers through GW, one of our nurse navigators, as well as a thoracic surgeon. And through that, I've continued to focus on lung cancer, learning more about how deadly it is, and really trying to get the word out about lung cancer screening as an option.
That's actually amazing. I know like in some of our events as well and some of our community outreach through the ALCSI club at Rice University, um it's been really satisfying to go out into the community and to speak with these people in the community about lung cancer and lung cancer screening. So in your community outreach efforts, I saw that you had like a myriad of events in the community. And what would you say is the event that stood out the most for you?
Yeah, it's really been incredible to do so many different types of outreach events throughout the DC and DMV metro area. I've loved my work doing outreach with ALCSI. The one that stands out to me most, however, is this one organization put on um, a community fair, community day, and it was sponsored by the Places of Worship Advisory Board in DC. And so they get thousands of attendees at Oxen Run, which is located in Southeast DC, where we do see a lot of disparities, whether that's income or health. And at this event, I got to coach some neighborhood health ambassadors. I also got to work with volunteers, oversaw a medical student that was volunteering at our tent, was able to connect with new GW faculty, and also, of course, reach community members who were dedicated to be out at this community day despite the heat that is very common in August in DC.
Yeah, that's great to hear. We've had the pleasure of obviously working at you with you at a few tabling events, and they're really enjoyable. I know I've really liked events where we've gone to elderly centers because the people there are just so receptive, and we've had some great conversations. So, I'm glad to hear that you're just as engaged as we all are. And so to sort of take the conversation in a different direction, a lot of people don't know many things about lung cancer, especially if they're not sort of in that sphere. So I was wondering, what are some of the big things you've learned about lung cancer since joining the GW Cancer Center team?
Yeah, I feel like I'm constantly learning so much about lung cancer itself as a disease and also lung cancer screening. And in my outreach work, I've realized how few people even know what lung cancer screening is. There's a very stark contrast in the kind of understanding that I see in community members around mammograms and colonoscopies. Those are pretty well received, there's a lot of knowledge in community about both of those screening options, but it's not until I bring up lung cancer screening that I start to really have to explain the eligibility and who, should be looking into this. And so um, it's been shocking to see considering the high mortality rate of lung cancer. And so really trying to get the word out and focus on lung cancer as a priority in the community and during my outreach has been really meaningful.
That's awesome. And I know sometimes it's really difficult to try to get the word out and trying to introduce these new health concepts to people who've never heard of them previously. And in your opinion, what would you think is what would you say is the biggest challenge in interacting with people who are disengaged from their care?
Yeah, that's a great question. People are really afraid of the C word. Sometimes they don't even want to come to my table because they see that I have a tablecloth that says GW Cancer Center on it. Or on the flip side, they know what they need to do. They know that they're behind on their screenings, but they're kicking the can down the road. They're focusing on other needs as they pop up, the needs of their family members, the needs of their children, and deprioritizing their own health and their own screening. And so, really engaging a hesitant population and helping them to navigate some of those hoops is the way that I have found to be most impactful and to be most helpful and resourceful to these communities so that they're less likely to be discouraged. I think we've all had experience of navigating the hold times, trying to make an appointment once you finally get the motivation to, and then you have to jump through all these hoops to actually see a provider. And so I have found that through patient navigation, helping them to set up a primary care visit, texting them links, calling and following up with a reminder, those are the ways that we can really help them navigate through to care and make it seem like less of an overwhelming burden.
Yeah, and one thing you spoke about was sort of the C word and how when people see the word cancer, they might be afraid to approach you or sort of talk to you. And that's something that sort of we see as well when we table. So I was wondering, what are some ways that you try to set up the table or just interact with people to sort of make it more welcoming so that people may not be as afraid when they see, the word cancer or I'm here to talk to you about lung cancer?
Yeah, I love bringing out freebies, whether that's little first aid kits or water bottles or hand sanitizers, anything to kind of draw people to the table. And also recommending and emphasizing that a lot of cancer prevention is diet and physical exercise. So, I'm not only talking about cancer, I'm also asking people, oh, do you want to know 25 ways to get moving at home? And so, really trying to weasel your way in with any sort of helpful information that they could take with them and think about further after the interaction is what I've found to kind of battle the big scary C word.
Yeah. Um, I think that's a great idea. I know sometimes we'll bring out like a little spinner wheel, and a lot of times like that's great for bringing people in. So, yeah, I think that's a great idea. And so another big part of your job in outreach is coordinating with other groups in DC. So I was wondering, what are some of the other big groups in the DC area that you work with, and how do you sort of set up that coordination with them?
Yeah, I've had the pleasure of working with Longevity, which I know ALCSI has worked with as well, Prince George's County, Breast Care for Washington, Nueva Vida. A lot of these connections are with providers and with organizations that are already giving a lot of services to the community. And so I usually find out about these organizations through DC's list of federally qualified health centers or also at convening groups that occur, whether it's the Ward 8 Health Council, tapping into any sort of monthly meeting that occurs with all of these health professionals getting together to strategize. I've found a lot of success through that, through tapping into the organizations already doing the work, and also asking yourself what you can bring to supplement the work they're already doing.
Yeah, it's amazing. And I think that'll be really helpful, especially for some of our other ALCSI chapters and members who really want to get involved in community outreach for lung cancer and lung cancer screening, just getting connected to these local community organizations and also just other national nonprofits such as Longevity that you mentioned, to try to get involved in this early on would be really helpful for a lot of our members to learn about. And I would say like I was wondering like what kind of in some of these coordinations that you've had with other organizations in the area, what kind of events or examples of events have you been able to host with the community with these organizations?
Yeah, so we were fortunate to receive a grant that helped us to put out a pilot program called Screen. And so I mentioned the neighborhood health ambassadors. This was kind of a network of individuals that we trained as community health workers because we wanted to identify underscreened women. And so by partnering with both Nueva Vida and Breast Care for Washington, those are both examples of how we were able to actually pay for uninsured women to get mammograms in a day of campaign. And so putting the money up to really, completely cover the out-of-pocket costs without having to bill through insurance, that was a huge collaboration that we did in about four different mammogram campaigns. So that was probably the highlight of my collaboration career thus far. But there's also much easier ways to collaborate too. Upcoming in March, actually, we are partnering with Longevity and a couple of the other providers to do a spring into screening event. And that is something I'm really excited for because that'll be a resource fair that is open to the general public.
Yeah, that's so great to hear. And I know that so many of like for us as well, like so many students, like so many of us, when we speak with individuals in the community, a lot of them talk about the money, if they're uninsured, the money to get screened, or if they do not fall into the guidelines for screening, the money to pay out of pocket for the screening. And I think just having an avenue to receive the screening without worrying about the money or the insurance costs is really helpful. And also something that we always ask all our guests here on our podcast is what do you think can be done to improve the screening rates in the nation?
Yeah, I think the biggest thing is ensuring patients have medical homes with primary care providers. Since so much of care and cancer screening is referral based, I really do think that it's crucial to have a relationship made and maintained with a provider, as well as continuing the conversation and outreach in high smoking hotspots or in groups that are known to have higher smoking prevalence, really trying to battle big tobacco and big vape to get the word out about screening.
Yeah, and in your outreach, I mean, you're interacting a lot with people who may be eligible for lung cancer screening, who may have family members who are eligible for lung cancer screening. So I was just wondering, through all those experiences, do you have any advice for maybe people who are undergoing that process or supporting someone who's undergoing the cancer treatment process?
I will always say that there's someone else in your shoes. You are never having a completely unique experience. And so there's really amazing support groups that are offered, such as through Cancer Support Community, which is a national organization, but also has a DC brick and mortar location. And these kind of support groups, I think, can be incredibly powerful when fear feels really overwhelming and it feels like you're in the complete unknown. But there are other people that can understand and that can work with you to support.
Yeah, I know we've had people on before like that sort of lead these outreach groups, like for instance the KRAS kickers, where you have all these people that are related because they have these specific biomarkers. Um, and it's just a great way, I think, to sort of generate the support and this encouragement for people that are going through it. So I think what you're talking about is a really great idea. And we've told our listeners, if you know anybody, please, do some research into that because it could be really great um, for support. And so I guess we can just sort of go into if any of our listeners, students, people who may have loved ones who are affected by lung cancer, is there any way for them to get more involved in advocacy?
Yes, I would say the first thing that you can do is keep up to date with current screening guidelines. You want to be equipped with the most knowledge to begin those conversations among your friends and relatives. Since we know that screening starts at 50, we are going to be talking to an older crowd, but you can never begin the conversations too early. I also think that a great advocacy pathway, if you are in the DC area, is Taken to the Hill, but also you can donate to advocacy organizations that you align with in your area or seek volunteering opportunities with any of these organizations that are doing the work nationwide.
That's awesome. And to end off our podcast, I was wondering like how listeners can get in contact with you to learn more about some of your opportunities, your experiences.
Yeah, absolutely. Well, they can absolutely go to GW Cancer Center's website. They can shoot me an email too. Would love to talk to any interested listeners.
That's amazing. And again, like thank you so much for being here for the podcast. It's really been a pleasure and honor to talk to you today and learn from the wealth of knowledge and experience that you have in this area of lung cancer advocacy. And I think that your wide variety of experiences interacting with the community outreach, with the community and community outreach events, I know will definitely be an inspiration for a lot of our listeners who are like a lot of our listeners and a lot of students around the nation. I know it's been really an inspiration for me as well, listening to all your experiences. And we really appreciate all the work that you do and the perspective that you have as an advocate and an educator.
Thank you so much for having me. It's
Yeah,
been
for
so fun,
sure.
and I really love working with ALCSI whenever I get the opportunity to. You guys are doing great work, and it's awesome that you already have such a passion for this, even in your undergraduate careers.
Awesome. Thank you. And thank you for our listeners as well for joining us on this episode of the ALCSI podcast. We hope you enjoyed it. And please keep an eye out for our upcoming podcasts and events, which will be posted on our website, www.alci.org. Thank you and have a great day.